Good morning, everyone, and thank you very much for the opportunity to come and speak this morning. Well done to Ken for organising the meeting, and a very big thank you to Roger for inviting me to speak this morning. I'm going to sort of work backwards this morning slightly. It was this time last year that Frank and myself were poring over an application to the Big Lottery Community Fund Programme, and we were looking to do some joint working. So Frank, in his role as the chairman and chief executive of the charity Cancer Black Care, which I hope all of you know, or at least know the work of, or go and have a look if you don't know them. But certainly we were poring over an application, thinking about how we might do some joint working, based on some of the learnings we could both bring together from our respective organisations. And what I want to do is to share with you the sort of the journey that Orchid, as a male cancer charity, has gone through to get to the point that we wanted to sit down with Frank and his team, put together the bid and successfully secure a grant from the Big Lottery of $370,000 in order to deliver a specialist prostate cancer project across 6 London boroughs. So I hope you find the talk interesting. I'm very happy to take questions, and Frank and I were chatting earlier on, and I think Frank will share some learnings from his side at the sort of the end of the session. So I hope you find it interesting. So starting point is a little bit about Orchid and who we do, who we work with. So as you probably know, about 50,000 men every year in the UK will be diagnosed with a male-specific cancer, which is prostate testicular. The numbers for testicular are about 2,300. Or penile cancer, the numbers there are about 600, and as you know, in prostate cancer, it's well over 47,000. So we focus specifically as an organisation on those 3 cancers, and in our opinion, we value each and every person who comes to us, each and every person we work with, because we believe that behind every man is somebody's father, brother, cousin, grandfather, friend. So it's really important to us to work across those 3 cancers. The one area that we don't work in is breast cancer, so we don't touch male breast cancer. We send people who have a concern or a worry to one of the breast cancer charities. So who we are and what we do, if you haven't come across us before, we are a small but nationally focused organisation. We deliver work in 3 very specific areas. So the first is in research. We fund research into 3 male cancers across the UK, predominantly at Barts. We have a very, very good tissue bank run by Professor Dan Burney, which is very interesting, and you'd be very welcome to go and have a tour of it. That's based at Barts, but our research is very much across the UK, and we also support international work, very much symposium meetings where we can bring together healthcare professionals. The second area we work in is around education and awareness campaigns. And one of the really interesting areas that we've developed over the last sort of 8 years is around our Male Cancer Awareness Week. There are some posters going around there. That has become a very well recognised annual campaign where we focus on raising awareness of the 3 male cancers. And we use it as an opportunity to talk to the media, to share case studies, to share some of our experiences, and to commission public surveys into awareness of male cancers. And I'm going to share some of that information with you in a moment. And the third area, and probably the area where we are now really well known, is around our range of support services. So as you can see there, we have a whole list of services. Many of you will know our cancer information nurse, Rob Corns, who I think has spoken at your AGM in the past, who is a very, very good urology specialist. We have a free phone helpline, which any of you are welcome to use. I'll talk about our prostate cancer project in a moment, but we also offer a counselling service for men who've been diagnosed with testicular cancer. We have publications and resources, some of which are around here in the room. We deliver a community golf programme. I'm very, very pleased to say that in our room today we have Professor Tim Oliver, who is the founder, or one of the founders of Orchid, who introduced a fantastic golf programme some years ago, and the aim was to get young people out, getting fit, getting active, enjoying sunshine, raising awareness of male cancer. So Tim is in the far back corner there, but absolutely delighted that he is here today. And one of the areas that we've certainly developed since about 2010 is our community-based roadshows. And I'm going to base a fair amount of the talk today on the roadshows and some of the learnings. We also have a very good website. Please do take the chance and the opportunity to have a look at the website and some of our information materials. So over the last 8 years is really where we've developed most of our services, And over those 8 years, we've learnt a lot about how men want to receive information, how they absorb information, some of the techniques and tools which make the absorption of information that much easier and more user-friendly. And also, we've learnt a lot about some of the barriers to giving information to men receiving information. And I want to share some of those with you. And they can really be grouped, this list, into sort of 4 quite specific areas. So the first 2 are really that sort of lack of understanding, lack of knowledge of signs and symptoms of male cancers, particularly prostate cancer, misunderstanding of things like how they're diagnosed, how they're treated, some real anxieties, for example, around how treatment might affect relationships going forward, how the diagnosis process is, what is a PSA test, where do I get a PSA test from? What happens if my GP says no to me having a PSA test? So some real misunderstandings around that. The second group is really that sort of sense of if I ignore it, it will go away. If I ignore it, some of the signs and symptoms that I might be worried about will go away. And that is a real challenge. It's a real challenge to get men talking and acknowledging their symptoms and doing something about it. The cultural differences is a really interesting one. So a few years ago, we delivered an awareness program for Dudley PCT, and we delivered a second program with the Borough Council. And one of the things that we were looking to do was to target men from Black African and Black Caribbean communities. For the sake of ease today, I'm going to call those BME communities. So trying to get to those communities, getting them aware of the PSA tests, getting them to understand what a rectal examination was, why it was important, getting them to understand why you would be tested, why you'd be treated, and what some of the outcomes of the treatments were. So some really interesting cultural differences that we had to address. In terms of attitude to care, one of the things that we do find quite a lot is that there's very much a them and us attitude across some communities. So very much me as a patient, them as a healthcare professional. There's a lot of distance. There's a big barrier between actually being able to talk to those people, and cultural taboos as well, as I've already referred to. Work patterns and some of the challenges of actually getting to healthcare professionals are a really big barrier, and I'm sure all of you in the room have encountered this either in talking to men or with your own experiences. But certainly one of the things that we found in doing our conversations with men and doing our roadshows is that there's a real concern and a real challenge just getting that appointment to go and see the GP. So building yourself up to actually make that call to the GP, getting past the receptionist and actually making the appointment can be a real challenge. Can be some real language barriers to men accessing services. Gender of healthcare professionals is quite a challenge. We often hear of men who actually go to see the GP to book an appointment, and they get asked all sorts of questions at that reception desk, which they really find very off-putting. There's several people nodding around the room. So a real challenge and very, very off-putting to men actually wanting to make an appointment. Engaging with healthcare professionals is really a big challenge as well, we've found over the years. People find it very difficult to have the conversation with the GP. They feel very nervous, as I've referred to already. There's very much a sort of them and us sense that actually happens. And a very poor understanding of the NHS and what it can offer. Several of you already this morning have referred to the PSA test. We know that in some cases GPs will refer to it. Men don't know that they can actually go and ask for it. They don't know what age they should go and ask for it. So all of those are barriers, quite serious barriers and challenges to getting an early diagnosis. There's been a lot of really good information written about what those challenges are and what the key findings are. And what I've done is I've pulled together some of the reports and comments that are already out there. One of the biggest challenges to actually getting to the GP is actually help-seeking behaviours. And by that we mean that men tend to be more reluctant to seek help than women. And I'm sure all of us in the room would find that. Many men will disregard the symptoms, they will ignore them, or they won't get the information they need, and many of them will be really reluctant to take time off. When we were doing our Dudley Community Roadshows, one of the big challenges we faced was that men just couldn't afford to take the time off to go to the GP. They were very, very concerned about their jobs. There's a big issue, and there's a lot of articles written around masculinity and stigma. It's just not manly. I'm embarrassed, and therefore it's just not manly. So let's just smile and get on with it and just ignore the symptoms. They may go away. Visibility, there's a really big area and a lot of information around visibility. So men aren't always seen as role models. Many of us around the room will recognise celebrities who champion their particular disease, whether it's breast cancer, ovarian cancer, but it's not quite the same role models that we'll find in men. And I think that's something that comes across time and time again. There's some very, very good female champions, but not quite the same with men. There's a real barrier to health and illness, just understanding and knowledge, and that can go right across different communities and cultures, but also across different socio-economic groups. We do a lot of work targeting communities where there's high levels of deprivation, because we do, and we all know that actually men from poorer communities very often have much poorer health outcomes. Hard to reach communities, they would include BME communities. That's a real challenging area. Getting to younger men can be quite challenging as well. How do you get to younger men, particularly in the age where people are on Facebook, they're on their phones constantly? How do you actually reach those men? And gender. Gender is a really big issue. How do you actually get your messages across to men? It's not always information presented in a very gender-friendly way, and how do we actually face that challenge? So what are some of the options to us? I'm sure some of you within your own groups use these, but I thought it would be helpful to just look at some of the options that are out there and also some of the options that we use. So certainly in recent years, there's been a lot of work done around sports and social events. Organisations like Prostate Cancer UK, who I know are here in the room today, organisations like ourselves go out into sports centres, go out into clubs and talk to men, give them information. Making activities that are very easy to access, easy to go to. So we do a lot of work, which I'm going to talk about in a moment, around our roadshows. Being in a public space, being there giving out information, it works very, very well for us. Finding information and support amongst friends and family members is a really key part of engaging with men. There's nothing like word of mouth, partners, family and friends giving out information, talking about their own experience to encourage men to go to the GP. Volunteers and ambassadors, we've recently developed a volunteer program, and one of the things that we do is we take our volunteers, take their experiences and share those with other men. So in one of the roadshows we've had just recently, we've had a gentleman who's been treated for penile cancer at the roadshow, talking to passers-by, talking to men about his experience and why it's so important to get to the GP and get tested, etc., as early as possible. Accessing information and support in a really relaxed environment is so important. One of the surveys that we commissioned a few years ago showed that a huge barrier to men going to the GP is that the GP office, room, etc. itself wasn't very inviting and wasn't very friendly. They just felt that the environment itself didn't allow them to walk in easily, to have a conversation and make them feel relaxed. One of the things that's really important is to actually work in partnership, and that's why we were very pleased to be working with Cancer Black Care on this new project. So working with other organisations, working with CCGs, working with GP practices really does make a difference, just in terms of giving out information. Going to the GP practice, leaving materials, leaving information, really encourages other people who might access those services to take your leaflets and to take out information. The other option, of course, is to be flexible and look at opportunities. You know, is there an opportunity to go out, have a stand, give out information, talk to people, get in the media? So all of these play a really crucial part in engaging men. In 2010, we started our roadshow program, and again, this was a pure opportunity. So we had a lady who had a donation of about £11,000 who wanted to give it to us, and she asked me what we would do, which would be innovative and different, and actually ensure that we could go out there and save men's lives. And we suggested that we actually put that towards running a series of roadshows. And the Orchid roadshows, we call them the Male Cancer Awareness roadshows, have worked very well. We deliver about 200 of these every year. Some are roadshows with the trailers, others are in a shopping centre, others are simply standing out in the street giving out information with banners, but they do work very well. And one of the reasons that they work very well, it's a very welcoming, informal environment. There's no one there to judge you. You can be completely anonymous. You don't have to give any details of who you are or any other health conditions. You can get information, you can ask questions without in any way being judged. And that's something that we know a lot of men are very concerned about when they go to the GP. It's a sense that they will be spoken to, talked about a range of other reasons, why they haven't been in here before, etc., etc. Our roadshows are an opportunity to get information in a very anonymised setting if you would like it. We always have an information nurse there, so there's the opportunity for you, if you're worried about your own particular situation, to speak to a nurse, to speak to a specialist, and get information and ask questions. And it is a really good opportunity, we find, for people who are on that borderline of thinking about going to the GP, but they might be slightly nervous. Second time round, we take our roadshows as often as we can back to the same location 2 or 3 weeks afterwards. And one of the things that we find is it gives people an opportunity to come back and talk to our nurse, come back and talk to our staff, either with a view to sharing the experience that they've had at their GP, or to share their test results, or to have an informal conversation again about something they might be worried about. Very often we find that it's the wife or the partner who's come to the first roadshow, and she or he will bring that person back to the second roadshow, and that works very well. I have to say women are, or partners are very, very good at actually bringing them along for the second one. So they do work very well. This is some of the feedback that we've had from our roadshows and visitors. And I think one of the most important things that the nurse and I find is that it's just that opportunity to talk for as long as you want. That really makes a difference. I think everybody today feels that if you go to the GP, you have your set time, and as wonderful as your GP is, you do recognise and you do feel that you're on the clock. Whereas actually with our roadshows, you can talk for 10 minutes, 15 minutes, 2 minutes, whatever you need, and it really, really does make a difference. And one of the other things that we found very interesting is that a number of the men who've come up to the roadshows as well were made aware that they could ask for the test and they should be given the test. And that really has been quite illuminating for us. So some learnings from our roadshow. I'd say the most important one is that it's an open door. You can walk in, you can ask questions. We use people who have been at the roadshow who have had the disease or have been treated. That works very well. There's nothing like that peer-to-peer support, which I know is so important for your groups. But just being able to come in and have a conversation really does make a difference. We always use men at our roadshows, so we're quite a female-heavy organisation, but certainly within our roadshows, we always have men there giving out information, having a conversation. And one of the things that we've been looking at is hard-to-reach communities. So making sure that our information, that our style is relaxed and informal and non-judgmental. So there is very much an open door policy. And also signposting to other services in the local community is very important. Signposting to other organisations, so we signpost to Tackle, we signpost to Prostate Cancer UK or CR UK. So it's really important that actually those roadshows are an opportunity to learn and absorb information and also to share that. So from all of those learnings, one of the things that we then started to look at is the work that we were doing with men from BME communities. And we've delivered 2 separate roadshows across Dudley, so one for the PCT and the second one was for Dudley Borough Council. We've reached over 2,000 men combined at those roadshows. The target audience was very much men from BME communities, and as you can see, those are some of the challenges that we were asked to actually look at and to address during the roadshows. The roadshows worked very well. The feedback and the evaluation has been very successful. What came very, very high on the list was the sense that those men could come and have an informed conversation in a relaxed setting and very non-judgmental. They could ask any questions, so they challenged us on things like sex and relationships. They challenged us on, I'm too young to be diagnosed with prostate cancer. They challenged us, and we looked also at some of the cultural taboos and attitudes to care that were there. So very much, the doctor is not over there and you're not here. Work with your GP to actually try to get more information, to understand the PSA test, to ask questions. We tried to encourage those men to access care. And one of the interesting things about the first roadshow we did was that we had a real challenge trying to get GPs engaged in the project. So for the second roadshow, we just went out and we talked to men. For the first roadshow where we were engaging with GPs, that was a real challenge. We couldn't get GPs to come to the training sessions. We couldn't get GPs to do one-to-one sessions with us. It was a real challenge. And for us, what that highlighted was the need for GPs to have their own training, to have their own separate information, and to be tackled quite separately to the community group that we were trying to tackle. We worked very closely with some of the community leaders in delivering this project. So if any of you are thinking about going out and delivering roadshows or targeting specific communities, I would urge you to work with community leaders or people who that particular community will want to engage with. Whether it's men from African Caribbean communities, whether it's a Polish community you want to target, whatever your audience, think about how you're going to get your message across and who you can work with to really champion what we do. So from all of those learnings, as I said, Frank and I sat down together and looked at putting together the big lottery application. Our aim was to use all of the learnings that we'd had over the last 8 years in delivering information, in addressing some of the barriers, and in looking how we overcame those barriers successfully to actually come up with a project that would bring those learnings together and deliver some really successful outcomes. And we went to the big lottery, and what we put to them was a joint project across the two organisations, whereby we would go out into 6 London boroughs. We would deliver a combination of roadshows. We would talk to healthcare professionals, get them engaged in the project. We would sit down and get some support mechanisms going together. So that could be one-to-one talking to a specialist nurse. It could also be getting people sitting in a room together. And the idea was that the project would really look to overcome some of the challenges behind prostate cancer. And as I said, we were very fortunate and very lucky in that we actually got the grant last year, and we've just started the project this year. So hopefully this time next year I'll be able to tell you some of the outcomes. One of the things that we've already found is that those one-to-one conversations with men in the community settings and getting community champions is really important. So OK, who is over in the far corner there, is our prostate cancer administrator, and what he's been doing is going into barbershops, giving out information, talking to them about the project, talking to them about what Orchid does and what Cancer Black Care does, and actually trying to engage with them. And some of the findings that we've had already just in the first few months of the project have been quite interesting. So certainly OK shared things like, it can't happen to me, where is my prostate, which is one of the things that we find really interesting. We did a survey a few years ago which asked members of the public where they thought their prostate was, and 20 to 30% thought that actually women had a prostate as well as men, and they couldn't identify clearly where the prostate was. And I think the stats are the worst still in the States for that as well. So, some real sort of learnings that we're already getting around the project. And certainly OK has gone out and talked to some of the community champions. So we're talking to religious leaders, we're talking to people who run specialist support groups, we're talking to some of those networks in the local area about the project and what we want to do in order to engage them. As I've said, and I can't reiterate it, if you are going out into a community setting and you want to deliver successfully information, make sure you know how to talk to people, make sure the information is right. If you've got a community that's made up of a high number of African and Caribbean men or a high number of Polish men, try to get people from those communities on board. And finally, this is the information. If any of you would like to get more information from us, or if you'd like to contact Cancer Black Care, these are all of our details, and very happy to take questions.
Thank you very much.